Hello, how are you all? I hope you are having a good rest and spending time well with your family this quarantine season. So anyway, let's go to our topic. This is Block 6, Physical Therapy 1, or Introduction to Physical Therapy, and our topic for today is international laws on um, on physical therapy. All right, let's go to the next slide. So first, let I think you already have discussed this, the American Physical Therapy Association. So you can pause this and you can read the description. You can pause it for maybe 10 seconds and read the description. Okay, so your American Physical Therapy Association is based in Alexandria, Virginia, in the U.S. Here in the Philippines, we have the PPTA, or the Philippine Physical Therapy Association. Though here in the Philippines, we don't have what do you call this? We don't have a voice when it comes to enacting laws um, towards to change the status of our profession in this country as compared to the US, where it is well represented. The APTA is well represented in the Congress. So, one of the advocacies of our regulating advocacies for American Physical Therapy Association is that they aim to drive federal policy on the issues that impact a physical therapist, physical therapy assistants, and physical therapy students, as well as patients and clients. Also, they have an active legislative issue such as the telehealth, which you will discuss next year, second semester. Telehealth, health referral, workforce diversity, education, and student loan. So here, let's go to the sections of the APTA. So we'll just go through them briefly. So what do you mean when you say acute care? So this means that patient receives a short-term treatment for a specific injury. So, like for example, when you have an ankle sprain, or when you have a neck pain. So the first 2 weeks, or the first few days wherein the pain as is at its peak, is what you call the acute care. So if the pain lasts for more than 6 months, so you call that chronic pain. So in the rehab, you will most likely hear, oh, so how long has your pain, or how long have you experienced this kind of pain? So if it's an acute pain, or if it's a chronic pain, you um you you make you make you assess, and then you make a diagnosis, and you plan for a treatment care, because the acute care management and the chronic care management is totally different from each other. And then we have the aquatic physical therapy, which again you will learn next year, second semester, on your therapeutic exercises. Basically, this one speaks about that, like how warm versus cold water can be a form of treatment, that there are multiple depths um, which your patient can immerse into, and that how what are the benefits of aquatic physical therapy for pain management and such conditions. So next, cardiovascular and pulmonary. Again, I think this is self-explanatory. So we also have a branch of physical therapy that deals with cardiovascular and pulmonary, and then you will have a pulmonary. You will have another. You will have a whole set of topic about this in your therapeutic exercises. And then clinical electrophysiology and wound management. Wound management here talks about pressure sores or burns. Yes, it's part of our description, that we are able to provide management for that kind of conditions. Clinical electrophysiology is by the use of EMG for diagnosis, use of electrical stimulation for various conditions. Education is for physical therapy students as well as for professionals to continue being educated in practicing our field, so that we are well knowledgeable to practice our craft. Federal physical therapy. This one talks about uh, excuse me. This one talks about the systems that or rules that are created and enforced through social and governmental to regulate conduct. All right, so here let's go to the next one. So geriatrics is a form of rehab that deals with elderly patients suffering from dementia, osteoporosis, and any severe arthritis or any conditions that deals with the elderly. Hand rehabilitation. This is, you will be surprised to know that we have a multitude of patients having to go through hand rehabilitation. Others would include carpal tunnel syndrome for or gamekeeper's thumb, and anyway, you will discuss more of this. Health policy and administration. So this one talks about the management of different kinds of setups, such as hospitals, big companies, or CBR, on how to manage those kinds of setups. Home health is what we do here in the Philippines. I think we the other terms for this one is house call. House call. So basically, you have a patient, you go to their house because it is inconvenient for them to go to the rehab or the clinic, so you go to their homes instead. So this is a whole another branch of PT that we have to deal. Neurology is dealing with patients with neurological conditions or nervous system. Oncology is having to deal with patients with cancer. Orthopedic talks about the musculoskeletal systems or conditions related to such. And pediatrics talks about conditions with infants and up to the adolescent phase. So someday after you pass the board exam, or when you are already a professional, you have these branches of physical therapy where you can choose to have your practice on. So private practice is also a branch. If you want to work on your own, you have your own clinic. Research is also an emerging trend in physical therapy. You look for you you conduct research and studies to further enhance our practice. Which ones still works, which one don't. Um, So yeah, you will have by the end of your internship or during your internship, you will conduct a research of your own. Sports physical therapy is very common among male or yes, sometimes even female. Um, uh, what do you call this? Active students who in the future may want to pursue sports physical therapy. This is actually a also like a growing trend. I know many students who would want to pursue this field. Women's health, talks about um, like for example in your therapeutic exercises too, we have a subject called obstetrics and gynecology. We also deal with that as well. So, what are some of the functions? So, here, trying to ensure that providers are competent where services paid by the government programs, ensuring that the money of the taxpayers are spent appropriately, and may vary from this. This also may vary from. I sorry. This also may vary from state to state. All right. So here in the Philippines, it is quite different because we are all under the roof of one government. So here, let's go to law. So first is what is law? So it is a body of rules of action prescribed by the controlling authority and having binding legal force. And statutes are enacted and established by the will of the legislative department of the government. What do you mean when you say legislative department? Legislative means the Congress, and the Congress is made up of your House of Representatives and the senators. Okay, so right, so basically it is like a certain practice. It focuses on certain practices and customs that we have to deal with. Others define law as basically as the science and the art of justice. So here in the U.S., um, they have different kinds of statutes that deals with like here, for example, number one is ADA, Americans with Disabilities, Individuals with Disabilities Education Act, HIPAA, and Affordable Care Act. Though each of these programs have a specific role in enhancing the physical therapy practice in the US. However, here in the Philippines, it is quite different because we don't have a voice in the Congress or in our government. So it is different. So we only have basically PhilHealth here, and if you have the means, then you have like a private insurance or insurance that is shouldered by the company. And like in the US, they have these programs which you can avail. All right. So also in the U.S., as I've mentioned before, here we only have PhilHealth, and that is quite sad. In the U.S., they have Medicare and Medicaid. So basically, here Medicaid is they benefit pregnant women, people with disabilities, and with very very low income. So here you can see participants pay little or nothing for coverage. But in Medicare, participants pay deductibles and part of coverage costs. So it is a federally funded program. So basically, for those with who has no means of paying so they are covered under the Medicaid. So I will not dwell into this because anyway, I will announce later through your class precedents how we can further discuss this Medicaid and Medicare. All right, let's go to the next one. So here, let's go to wait, hang on. Let's go to fraud. So what is fraud? So yeah, you can read the description. So it is also the wrongful or criminal deception intended to deduct or a financial intended to result in financial or personal gain. So you often hear these words, oh, that is fraud, that is fraud. So here, state statutes enacted by state legislature in areas that states are constitutionally permitted to regulate laws in education, professional licensing, and insurance. Again, when you say legislatures are, these are, again, when you say legislator, these comes from the Congress again, and the Congress is made up of the House of Representatives and the Senate. Uh, so basically, every bill or every law goes through them before it can be passed. Practice Act. So it is the legal foundation and the scope of protection of physical therapy practice, definition of practice, identification of tasks, identification of providers who may legally provide PT care. All right, so licensure. So in the Philippines, we have the physical therapy licensure examination, which you will take after you have finished this course, and by passing, you will have that PTRP suffix right after your name. So this enables you to practice legally here in the Philippines. And right after that, you go to the US, and then you will take their National Physical Therapy Examination, or the NPT, and by then you can practice. So you can practice in the US. So it is very, very important to have a license when you practice PT here in the Philippines. For legal purposes, of course. So that's how important it is. It's like you have a permit. Basically, you have a permit to practice, just like any licensure examination. For example, the drivers, yeah, drivers. To put it in simple terms, like how important it is, you cannot drive without a license. If you do drive without a license, then you take major risks, right, in doing such, because violation are by by all means punishable under the law. So where was I? Hang on. Oh, wait, hang on. Okay, so here, let's go to professional. Sorry. So here, regulation. So the parts of the federal examples of the federal regulations include DOLE, which means Department of Labor and Employment, Social Security Administration, or here we have the Social Security System, or the SSS. IRS is the Internal Revenue Service, and here we have the BIR, or the Bureau of Bureau of Internal Revenue, and the CMS, Centers for Medicare and Medicaid Services. So basically, IRS here, or IRS in the US, and BIR here in the Philippines, deals with your taxes as a professional. DOLE, which takes care of your rights as an employee. Wait, where was I? And here, how regulations are here professional conduct. So this one includes ethics, morals, and standards of behavior when practicing physical therapy. So it is because if this plays a very important role in the scope of our practice. That's why you have, I think, two ethics course in this curriculum, because we want to protect the integrity of our practice, right? We do not we will as an individual, I think we have that duty to preserve our morals. And what more if you're a professional? So you have the duty to protect your morals, and you should act with with uh, with care and with proper conduct. So this outlines ethical principles that govern in deciding um, the behavior among our profession. So here, how statutes are made. So I'm not going to dwell much of this, but basically, you propose a bill, and that bill will be sent to. So if you're part of the Congress, you propose a bill, and then that bill will be introduced to a committee or to a legislative committee, and if passed, here is referred to the House. If not, it dies in the committee and will have to be reintroduced. So it will undergo the first reading and then the second reading, and if the majority agrees, then here, at least here in the Philippines, the president will sign for it to become a law or a bill. Okay, so how regulations are made. So an agency must first publish a proposed regulation, and at the federal level, proposed and final regulations are published daily in the Federal Register. So anyway, here, well, let's go to the next one. We have civil criminal law versus civil law. So criminal law involves prosecution in a court of law. So basically, any crime punishable under the revised penal code, it deals with crimes and the legal punishment of criminal offenses, while civil law deals with the disputes between individuals, organizations, or between the two, in which compensation is awarded to the victim. So this includes defamation, breach of confidence, breach of contract. So also claims of negligence and malpractice. So our practice, though in my years of practice as working in the hospital, I've at least here, at least most of my colleagues haven't dealt with with charges of negligence and malpractice. So here, negligence is, again, I'll give you time to read. You can pause. Okay, and negligence. One example is here: failed to provide the appropriate standard of care. Patient injuries were directly caused by the parents, but the therapist's failure to provide service. One example of this would be. Although it's not part of our no, one example would be, for example, you spilled a cup of water beside the patient's bed, and you forgot to clean it, or you forgot to mop it, and then as the patient went down from his or her bed, the patient slid and acquired further injuries. So that would fall under negligence. Patient sustained injuries or damages through your negligence. And malpractice here is professional negligence. So one good example of this would be you you did not read the new orders from the doctor, so you you failed to you failed to do what the order says. So again, that led to a to further injuries with the patients. Like for example, you failed to check the blood pressure of your patients before doing before doing your physical therapy session, and then at in the middle of the of your treatment, the patient suffered from hypertension, right? So because it is a failure to meet a professional standard of care. So because as a professional, you're supposed to do this, and if you have failed to do that, then you can be sued for malpractice. Also, one very common example would be like burns in a patient. So hot collator packs or hot moist packs is you usually leave it on the patient for 20 minutes with sufficient towels, but then you failed to put the sufficient amount of towels that led to the that led to the reddening of the skin, and eventually the patient suffered from maybe a first degree burn or a degree burn. So that is a form of medical malpractice. Contract law, it is an agreement between two or more persons which creates mutual obligations to do or not to do particular things. So APTA. So here in the Philippines, again, we have your PPTA, or American Physical Therapy Association. So let's go to the end part of this lecture. So I'm sorry if I'm speaking way too fast, but as for your written what do you call this, for your written report, I will instruct your class presidents as well as the other things you have to do for the completion of this course. So principle 1 shall respect the inherent dignity and rights of all individuals. I think that's self-explanatory, right? Yeah, as basically, I think it is. That's the number one rule: respect everyone without without prejudice. And number 2, PT shall be trustworthy and compassionate in addressing the rights and needs of the patients and clients. Always put your patient's safety and betterment. Always think of it. So, for example, even always think of how the patient can benefit from the service you are giving them. I think compassion plays a very big part in our profession. You cannot be a physical therapist if you do not have compassion. PTs shall be accountable for making sound professional judgments. PT shall demonstrate integrity in their relationships with patients, clients, families, colleagues, students, research participants, other healthcare providers, employers, payers, and the public. PT shall fulfill their legal professional obligations, enhance their expertise through lifelong acquisition and refinement of knowledge skills. Anyway, Anyway, I'm not going to discuss any further of this because this will be a part of your written submission. If you have any questions, I will be more than willing to answer all your concerns. But anyway, I hope you had a I hope you I did I hope like you find this lecture what's the word I hope that you learned something out from this lecture. So further instructions shall be given to your class presidents. Anyway, spend your time spend your time well with your family. um, Try to live healthily, okay, and do things that you haven't done when you were busy every day. Anyway, see you soon, hopefully. Bye.